All right, welcome. This is the Wellness Quacks. My name is Dr. Dylan Clark. Yeah, don't you love that? Wellness Quacks. My office is Peak Family Chiropractic here in Colorado Springs. Always a big shout out. Thank you to 719 Lending. You have any lending needs, come here first. They do a really good job, take good care of you. Shout out to them. I want to thank them for letting us use their studio. But today we've got a great topic. We've got a couple guests. We have
Tim Chase here at 719.
And
Nicole Corwin here at 719.
Yeah.
Oh, nice, Nicole.
Nicole brought the beauty into the room. We're
she
thankful
did.
for her.
Aw, guys, stop, but keep going.
Today we're just kind of going to do like an interview type setting to talk about chiropractic, what you look for, and then kind of from a person who's not a chiropractor, what you look for when it comes to healthcare, how your view on health and how you take care of yourself, and kind of how we fit that puzzle piece.
Mm-hmm.
So, Tim, when you came in, had you seen a chiropractor before you came to see us?
Probably no exaggeration. Maybe 150 times.
You've seen a chiropractor?
Yes.
So you're very familiar.
Yeah, I'm familiar with entry-level chiropractic. Yes.
Yeah. Okay.
It might have been 150 separate chiropractors.
Yes.
And then have you ever seen a chiropractor?
I have. Just this last year, I saw one for about 2 months, and then I stopped.
Where can I ask where you went?
The Joint.
Oh, you went to the Joint. Okay,
Yeah.
so similar experience.
Yeah. Like I say,
It was because of him.
Yeah.
Yeah.
But it was fantastic for what for most of what I needed.
Yeah, so that's kind of what I was going to talk about, because some people will bash on the Joint. And as a chiropractor, one of the things that I just don't do is talk poorly about other chiropractors, because each one does kind of a different thing. A lot of things that one of the things people don't understand is chiropractic is still kind of the wild, wild west. Like when you go into the medical profession or you become like a DO, they make you do rounds and you got to specialize into a group of the body, right? Or like a system of the body, like a cardiologist or a neurologist, or you've got a dermatologist. So you go and you see like a specialist that's in one area of the body, but when you go see a chiropractor, like when we were done with school, they're like, see you later. And then you're like, okay, well, how do I do this? So then, like through a lot of chiropractors through their own journey kind of figure out how they can help different people. So I never bash on the Joint because like, what did the Joint do for you guys?
Well, you want to go first, Nicole? How'd they work for you?
It was nice. The only thing I disliked was like the inconsistency. Like
You mean who the chiropractor was?
Yeah, you would get a different person every time, and it was never the same adjustment.
That was the problem that I had as well. So if I had the right chiropractor, which I got occasionally there, frequently even, right? They did an amazing job. And then I would get one that I really needed a certain area, and they're like, well, I'm not really good at necks, or I'm not really, something like that. And so my experience with that is that I got to where I had a certain thing right at the top of my spine that just hurt like crazy, right? Hurt like crazy. And I would go to the chiropractor, and for some reason they couldn't get that spot. I would get with this one lady, this short little kind of brute looking lady. She would get it pretty good by doing like a side kind of snap. But here's the thing. They don't do x-rays. They don't do any exercises. And they just feel your spine, pop it, and you're done.
Yeah, I mean, like, what I call them is a really great whack-em, crack-em shop. That's what I call them.
Well, and that's it. I could get in, 15 minutes, I'm out, and I'll tell you, many times I felt very good after I left. Yeah,
and like, so that's what I mean. Like, at an entry level of a chiropractor, if you don't really know what they are and you just want to like get your body moving and feeling better, I mean, like, it's a quick, cheap. It's not a cheap thrill. I don't want to say it like that.
Whoa. That was good, Doc. Thank you.
A little AC/DC action in here. Which, side note, my daughter's like, Dad, what kind of music did you listen to? I like first went to AC/DC, started listening to the actual lyrics. First time in my life I actually listened to lyrics. I was like, this is not good.
This is a great song, honey. Never listen to that again.
Do what I did.
Yeah. So it's not a cheap thrill, but what it will do is it'll get you moving better, and but they're not going to dive down deep into any health concerns that you have.
Well, that's why when I went to your shop for the first time, I actually went to a lunch and learn with your brother and watched that. I said, "Hey, come in, $40. We'll do your initial consultation." So I come in, I did that, and when I did the X-rays, I was like, I really, really don't like long appointments. I asked him like 3 times. I'm like, dude, you've got to do this like fast. Like, I just want to get in, pop that thing, and get me done.
Yeah.
I have no patience to sit and wait. So there's a couple cool things. When I walked into your place, I got an X-ray, which I had never had. No, that's not true. Like one other time in my life, I've had an X-ray. Every other time, it's just been feeling popping.
Yeah.
And what I discovered was when you guys pulled up. It's like a side-by-side comparison. Like, this is the green line shows a healthy spine in all the areas. You were up and forward, backward, side to side. Like, you took every single angle. And then you had a red line exactly where my spine was. You're like, okay, this is exactly the spot we need to work on. Like, this precise spot.
Yeah.
And I'm like, I had no idea that I sat with my neck to the left, right? Like, I didn't know that I did that. But after going there a few times, like I've at first, I'll tell you, at first time I went to your place, I was freaked out because you guys hooked me up to this, like this, it was like a weight rack, right? Like at a gym.
I joke around. I tell people who've never seen it, I'm like, this is our BDSM room. Like,
well, it was
I'm going to strap you in here.
When can I make an appointment? I'll be there.
All the single women.
Yeah. So it was a little, but after I was like, man, I don't know about this place. This is weird. But then, like then you adjust me afterwards. I was like, whoa, that actually feels pretty good. And then now I've been going twice a week for a while. And now I look forward to it. Like, I've been thinking maybe I need to go 3 times a week until my neck gets lined up, right? And I learned, here's the other things, the education that I got from you guys, way different. Like, I would, the other chiropractors that like the whack 'em and crack 'em kind of thing it worked good, but it was like, oh yeah, maybe you need to stretch, right? Or I had one that used to tell me to drink more water.
Yeah.
But you guys,
which is generally true for everyone.
Yeah. But you guys are much different. You guys are like, hey, on average, you have to be in this position for at least 12 to 20 minutes for the body to adjust, and this is what happens when the muscle memory builds with this kind of position. And then you guys put us in that kind of position with a certain amount of weights and the frequency, and your body starts to learn how to get back to normal, right?
Yeah.
So that was a massive difference for me. I'd never seen that before.
Yeah, and that's like cool for me to hear because like everything you're saying is exactly what we teach. Because like sometimes this does happen too. Like you feel like you just teach and teach and teach and teach. Mm-hmm. Like that's what doctor actually means is teacher. So what drives me crazy is when people do see a doctor and then they don't teach them anything. Like, and then I'll ask them, well, why are you getting that? I don't know. Like you have no idea like what they're trying to accomplish here. So it makes me happy to hear that because, or let me back up. What I see is sometimes people start doing something. I'm like, that's not what I said at all. Like, how can I say this more clearly, like, without sounding repetitive and redundant? But it's nice to hear that because what I feel like is when you have an empowered patient, a patient who really understands and feels knowledgeable in the area, then they can really apply it themselves. You know, there's like there's a saying I've heard in a very negative way: once you see a chiropractor, you always have to see a chiropractor. And I kind of joke around because I'm like, well, same thing with your teeth, right? Like, only brush the teeth you want to keep. Yeah. But like the idea that we try to
3 of them.
Yeah.
that one.
I can tell.
I'm from
Kentucky.
Oklahoma.
Sorry, all my Kentucky friends.
Yeah. And Oklahoma too. Yeah.
Friends, yes, all friends.
But you know, like the idea behind what we're doing is what we want to do is like retrain the body so that you don't have to see us forever and you just come on a wellness program where you do it because it feels good and and it helps you be able to work better and do better in your life. Like that's really the goal, not just come in and crack and crack and crack and crack and crack, but actually retrain your body so it's where it's supposed to be. And then it can function the way it's supposed to.
Can I ask you a question on the education that I got there? And maybe you could just touch on this really quickly. I know Nicole has a question before she gets busy as well. But when the neck is out of place, so the head will weigh more when it sits left, right, forward, backward, right? But the leverage of that, the axis that it rotates on, Can you just tell me what kind of weight difference does that have? Like if my neck is left, right, forward, or backward?
Yeah, so it becomes exponential, really. That's a great question because sometimes when I explain to people their head weighs more, they're like, does it get bigger? No.
Obviously not.
Get it?
Your brain
The
is not
brain
big.
stays the same
Yeah.
size.
You don't have a lot of folds in your brain. You know? So no, what happens, it's the same idea as like a bent nail is how I like to kind of describe this idea. So if you hit a nail straight on, it goes straight down, right? But once it's bent, every time that hammer hits where it's bending, the load is higher, and that's why it bends even more. And that's the same thing with the head. So with the head, your neck is supposed to line up, and when it does, the joints of the neck, it's actually called the articular pillars because it creates a pillar. It interlocks. It becomes very strong. It's either 30 times. I think it's 30 times strong. It's either 30 or 60, but I'll go with the lower number.
Yeah.
Your neck becomes 30 times more strong. And just like a nail, like when a nail is strong, like how hard can you hit that with a hammerhead?
As hard as you want.
As hard as you want, right?
When it's bent, you're like quarter power. Trying to get that kind of tap that thing, tap.
Yeah, and then you're trying to like bend it straight enough so you can hit it just hard enough to get it to go down, right? The neck is actually the exact same way. If you screw up those articular pillars, what happens is as that, like for example, as the head translator shifts forward, then that weight and that just like in the bend of a nail continues to increase. Gravity is not going to decrease. Gravity is the same all the time. So the more that starts, the more that starts bending forward, the more those forces, especially in where that kink is in the spine, the more that will increase. Another thing that like always cracks me up is when I'll get like some people coming and be like, yeah, I have degeneration, and they'll say it like it's a normal process, like your spine just degenerates over time. It's called degenerative joint disease because it's a disease. It's something that comes abnormally. If it's aligned and the articular pillars are aligned properly, your neck will stay healthy for your life.
So could you have an 85-year-old person in there? I mean, outside of genetics, right?
Yeah.
Just outside of genetics, with a perfectly healthy spine, and say a 30-year-old just through lifestyle, again, not genetics, have something that's deteriorating.
That's a great question. So literally, my oldest patient that I've adjusted was 97 years old, and her spine looked beautiful.
Really?
She was cognitive. She was a little bit slow. She's like a Pentium 2 processor, you know? Like you'd ask her a question, she would have to think about it for a second, but then she would answer you. Like I asked her.
3 gigs of RAM.
But the computer was still working, man.
It turns on.
No, like you could ask her a question, and she would listen to it.
The RAM's a little slow. We got a spinny hard drive, there it is.
But no, she would like you could do it, right?
Yeah.
And then, conversely, like when you have a lifestyle of continual pain all the time, it will actually decrease your cognitive ability because your brain is overloaded with more that you have to deal with. So
interesting.
I've had like 30-year-olds who have had previous injuries and they just thought they'd get better on their own. And then as they get older, that degenerative process is actually really fast. I had a patient recently who this patient's neck looked horrible. A football player, I looked at the neck, and I'm not kidding when it was like a 50 or 60-year-old neck, like it was really old. His lumbar spine looked great. Like it looked fantastic. It was exactly the way you want it to be. The shape looked good, discs looked great, joints looked great, all that was fine. He's getting like numbness in his arms, and then I look at his neck, and he's like, "Can you fix that?" I'm like, how many times did you get hit in your head as a kid? Like a lot. And once that degenerative process starts, if you don't do anything to protect it, it will just continue. Yeah. It doesn't stop. So yeah, absolutely.
Okay, so you can't stop it with chiropractic care? You can slow it down?
You can slow it down, and theoretically you can stop it. I haven't been in practice long enough to see it in there. Like here's another drawback to chiropractic in general. Like I'll admit to this 100%. We don't have as much money as the medical profession in our profession. So we have some great studies. I've talked about Deed Harrison before. He's done a lot of phenomenal studies, but we don't have that type of money to put into studies like that. And that type of stuff is directly applicable to chiropractic. The medical profession in general does not care about the degeneration in your neck. They care about it in as far as much as can we perform surgery on it. So you'll find
surgery or prescribe you something.
Correct. So you'll find studies on that, but you won't find studies on, well, how do we slow this process down? That's expensive, that's hard, and it requires a lot of time.
Okay.
So theoretically, yes, you can slow it and stop it. I'll say I'll go out on a limb and I'll say absolutely you can slow it down. If that nail is bent way forward, I can straighten that nail out. Am I going to get it back to a perfectly straight nail? No, you're going to have a weak spot in the metal right there. But if you get it back, gravity is going to be able to handle it a lot better. Mm-hmm. That's the same principle. It's true for your neck as well. There's a law called Wolff's Law. And what that states is basically pressure over time will change a bone. So you can deform a bone with pressure over time. So
you can deform, can you reform?
You can.
Okay.
But you have to have enough pressure in the right direction. So if I've got bad pressure going here, even if I put good pressure there, it doesn't take the pressure off of what has been done. That's why the degenerative process is hard to slow down, because once you've changed the shape of it, well, the shape of it's different now.
Yeah.
And so even if I start bringing it back to where it was, you still have some deformities that you're dealing with. So stopping it's going to be tough.
Can I have somebody with massive deformity, degeneration talk for a second? Her name's Nicole.
I knew you were going to say that. Tim literally will walk into my office, daily almost, and he's like, "Gosh, you're so hunched."
She's hunched over like this. 'Cause, she's at her desk. You're at your desk a good 8 hours.
Well, it's coming from the vulture.
Yeah, I'm like the vulture.
So my question for you is, I feel like when I was going to the joint, right, I was feeling better. But since I stopped going, I feel almost way worse than I was before I went.
Yeah.
Is that normal? How long does it typically take to backtrack on what you've already done to your
until
body?
you're used to feeling crappy again.
He started feeling good, so a little bit of crappy feels like a lot of crappy.
Well, and I'm being silly, but I'm actually being serious. So,
yeah.
Especially when it comes to I don't know what your health history is.
Rough.
Wow. Don't work at 719 London. This is not an
Only
ad.
use them. I've been used. So. No, this is true. So, I don't know what your health history is. I'll just give you an example, okay? So, when I have, it's called a radiculopathy, right? So, if I've got nerve irritation, have you ever heard sciatica, right? That's the obvious one. You can have the same type of idea of sciatica in your arm, in your upper extremities. All that is nerve irritation. So, I use this example. My wife loves it when I use this example. My wife never really dated, right? So, when we started dating, I took her to the movies.
I'm just kidding. Just kidding. That's how you got her.
Get the insecure ones.
Catch them early.
I love you, honey. I don't even know what to say anymore. So, I haven't blushed in a while. Thank you for that. I'm going to hear about it later.
Welcome to 719.
Yeah. So, I took her to the movie theater. This is a true story, and held hands, and she really hadn't held hands with anyone really in her life. So she was kind of, it was kind of a new experience. She was having fun, and she started rubbing my arm, and she didn't move for 20 minutes, and she kept rubbing the same spot. Well, how does that feel when a person does that?
You're like, please stop.
Because it's irritating. I'm in the movie theater. I was like, I need you to move your arm right now. She's like, sorry. And I was like, no, you can keep doing it, just not in the same spot. Right? That's what happens.
You have rubbed my skin raw. I need some Neosporin, okay?
Yeah. That's actually nerve irritation. That's on a very localized scale. What happens in the human body is the nerve will do the same thing. So if you have a deformity, let's say in your neck, or let's say the muscles are bound down, and that nerve keeps rubbing, that's where that deep aching comes from, because the entire nerve root is irritated, not just the location of the nerves of where they come superficially, right? So if I take that and I release you from some of the burden of the pain, and then, but it's not gone yet, and then it comes back on, well, now that's a fresh injury again. And so, when I'm dealing with a person with with that kind of radiation of pain.
Say that word again. That's pretty cool.
Radiculopathy.
I'm going to use that today. This is just radiculopathy, okay?
You're such a systemic problem in my life.
So, like she's the nerve pain, but that's where it shows up.
Yeah.
Wow.
That's she's the
I was
nerve.
like, I was waiting for the systemic problem.
Like, huh,
Marquise is the
I see
root.
where we're going with
Yeah.
this.
That's the root of the problem.
The nerve root, yeah,
Yeah.
there you go. I mean, we could totally take this a step further.
Yeah.
Totally nerd out over here.
Please.
So when you take the pain off, and you get that relief, and you haven't had that kind of relief for a while, and then when it comes back on, it's fresh. Here's another example. If I grab your arm, can I see your hand? If I grab your hand and I just start
He
pressing
likes to
really
hold
hard,
hands.
I do. Yeah, that's my wife.
Jeez Louise.
No rubbing. So if I start pushing on the bone, it's going to hurt, right?
Yeah.
Now, I'm not going to do it too hard because I don't want to hurt you, but if I do that, that's going to get uncomfortable. After a while, your pain sensors, it's a pain gate, will start to ignore it a little bit. So, like, if you have a dentist that loves you, before they put the shot in you, they'll put pressure on the gum, and then they'll do the shot because they've deadened the pain nerves a little bit to the brain. They've lessened the pain gate, so it's not as intense. Well, if I take the pressure off of your gum or off of, like, the bone that I was pushing on, you're going to get relief, but then when I go back, it's going to be a new pain all over again. And so if you're getting relief and then you stop, when the pain comes back, it's going to feel very intense because you've had relief and now it feels new again. It's like you're reigniting the pain gate.
That makes a lot of sense.
Yeah.
Thank you.
So I was being funny, but I was actually serious when you get used to it again. When you get used to being miserable. That's why in our office, we try to look at what's actually going on.
Yeah.
An adjustment is great. It's going to help people. That's why I don't knock on the joint. They do great work for people. If that's what you want a cheap, quick adjustment, they do great work. You should do them. As a new practitioner, I'm a huge proponent. In school, in order to graduate, you only need 250 adjustments.
Wow.
I see
Sounds
160 patients a week. So, you know, a new doctor coming out of school goes to the joint. They get a lot of hands-on experience. They see a lot of different people. They see a lot of different problems. They feel a lot of things. They get great experience. The problem is you could be the guinea pig, right?
Yeah.
That's not my jam. My jam is figuring out what's actually causing this so long-term you can get relief and go back to your goals.
Yeah.
Yeah.
Makes sense.
I need to actually go through with my initial appointment with you guys. Like I paid and everything. I just haven't gone.
Did you?
So, yeah.
Yeah.
Well, hi, I'm here.
Marquise, what do you have for him?
Oh, wow. That's kind of
There was something hard at him.
A rock? No.
Yeah.
We don't have any.
Well, let me go back to this, and maybe you'll get a question while I'm talking.
Yeah.
So when it comes to chiropractic, one of the issues is another issue that is there is once you graduate, you're kind of on your own, and you kind of got to figure out your own path and how it works. So what that does is it creates a lack of consistency in the field as far as like expectations and what you're going to see from practitioner to practitioner. So you have really good practitioners, but what we're trying to do is figure out what works best.
Right.
So what chiropractors will do is they'll really adhere to a technique, which is an adjusting style
Right.
or a way to approach the body. If you want consistency as a patient, what you have to look at is a person who kind of does the same thing or the same type of technique or the same type of style. Because then they're going to look at the body kind of the same.
Yeah. Well, maybe you should ask Corey what his question is first,
Yeah.
since he just walked in here.
Hey, Corey. We have Corey with us on the show.
Hello. First of all, I like your tie.
Thanks,
it's
man.
tropical. We're getting into summer.
Yeah.
It's got me festive. It feels like it's Friday, even though it's Thursday.
This tie is where my mind is like probably 80% of the time.
Right on. So I'm a difficult guy to be on here because I'm one of those chiropractic skeptic people that think that it's a pseudoscience and
Yeah.
like you're gonna mess my back up.
Yeah.
And is this an ancient thing that's been around longer than I know? And tell me why I'm wrong.
Okay, yeah, absolutely. So yes and no. It has been around for a while, but not the way that it is now. Back in the late 1800s is really when it came about the way in the form that it is now. The idea of healing on hands is kind of the root of chiropractic. That's been around for a long time. But I'd say the reason why you're wrong, Corey, that's like almost weird to say because I've been taught never to say that to an individual.
No, it's good.
Yeah,
If
you
somebody's
ask
wrong,
them
you gotta point it
questions.
out.
Yeah. So, well, let me start with this. Like, what's your understanding of like why does it feel like a pseudoscience to you? I know there's like some big names in the field that say the same thing. Like I've heard, I listen to Joe Rogan. I mean, he's like the ultimate podcaster. I've heard him like bash on chiropractic, but no one ever really gives a lot of reasons. would you indulge me?
So absolutely. Even though Rogan and I agree on a lot of things, I actually didn't know he was a fellow skeptic.
Yeah.
But it makes sense because
Yeah. Because you're both geniuses, right?
yeah, we both fool people into thinking we're smarter than we are.
Yeah.
I guess in my case, I've never really had a punctuated or apparent need. In my mind, for adjustment, I've had car accidents. I used to box. I've had a few physical entanglements with rocks and curbs and things. But I've always been skeptical as to the necessity of it and what it's going to do other than the natural physiology I already have.
Yeah, okay. That's an excellent point. And I think a lot of people actually feel the same way, especially when it comes to like why do I need to see one? I feel fine, right?
Yeah.
When it comes to like the pseudoscience of it, this has actually been a battle that's been raging a long time.
Cool. Let's get into it.
Yeah. This goes back to like Wilkes versus the AMA. At the turn of the century, you know, like it's okay. Like I don't even know where to start. There's so many things. Okay, so like when it comes to like the medical profession,
Yeah.
when they did like bloodletting, everyone thought that was normal. If I tell you that bloodletting was a normal thing, what would you think now?
Well, hermeneutically, if I put myself in 1680.
I'm talking about now.
Oh.
Now we know what we know.
Oh, you're a crackpot.
Yeah, okay. What about like a lobotomy? Because that was performed up to the 1970s.
A frontal lobotomy?
Yeah.
I'd rather have a bottle in front of me.
Yeah.
Well, I mean, right now it's like, don't take my brain.
Yeah. Now we understand, right?
Yeah.
Like the thing is I think a lot of times it comes down to propaganda and financing and what you have to be able to get a clear, concise message out
Sure.
there. And one of the issues with chiropractors is that we're very opinionated. So coming together on a clear, concise message has been very tough for a very long time. But when it comes to the actual science behind it, I mean, like, to me, I could like show you picture after picture. When the spine is in line, then your spine functions better. Your spinal cord functions better. There are tons of studies that I could show you where your nerve function, you have a smoother nerve. It's like when they do a nerve conduction study, your nerves are functioning smoother, clearer. They recover faster. They recover better.
This makes complete sense to me.
Yeah.
I mean, this is like neurological science. It makes sense. And I think you have to be barefoot in an Appalachian village to kind of not agree with that. I think where my question, and maybe some other people's minds are at, is how many people are you seeing that you can verify through either sonogram or ultrasound or whatever you're using that their back is actually not straight, and then subsequently what you do actually straightens it.
Yeah. Again, that's what I was trying to get to. It's a great question.
Sorry.
No, you're good, man. That's not question. Like, there's no question about that, right? And then if that gets too far out of alignment or that gets shifted too much, you start impeding on the neurology of it. And you can see that like on MRI, you can do nerve conduction studies, et cetera, et cetera. What we now know is that there's normal limitations that you should be in. So the ideal model, the perfect model of the spine, for example, the cervical neck should have a 42 degree curve. When it has a 42 degree curve, then the spinal canal is nice and open. There's lots of room for CSF fluid to run around it, and the spinal cord to run around it.
So I'm looking at this like, kind of a neophyte. You're talking about the curvature front to back, not side to side.
No, I'm talking like if I'm looking at you from the side,
Yep.
it should have a curve in it.
Okay.
If I'm looking at you straight on, it should be straight up and down.
Okay.
Okay. We know that when that alignment is there, we know there's the most amount of room for that spinal cord to be able to breathe and move. And the nerve roots coming off of it that go to like, your body, your joints, your muscles, all that stuff, that is operating, and the nerve conductions are nice and fast and smooth and clear. We know that. And what we also now know is that once that gets below about 20 degrees, so there's a range from 20 to 42. Once it gets below 20 degrees, then the impedance starts becoming so strong that you will have, there's a direct correlation with neck disability.
How about calcification on that junction between your spine and your neck? I've been noticing, I guarantee you, my fiance's listening to this.
Yeah.
She's like, don't listen to him. His back is messed up. I have to massage him every night. Please help him.
Yeah.
But-
He's saying it's pseudoscience, but I have to massage that mother.
Exactly. So one of the things that her and I both deal with is that we have this, I call it a bulb, where your back basically meets your neck. I don't think that's anatomically correct, but you know what I'm talking about. It's
I know
basically
exactly.
between
It's
your
called the
shoulders.
vertebral prominence. It's supposed to be more prominent. It's the transition zone between your neck and your upper back. When people think it's pseudoscience, like what an adjustment is going to do is it's going to help the joints move better. Okay? And when you have better joint movement, you just have better movement equals better flow equals better blood movement, right? Like movement is like the health and vitality of the body.
Yeah.
That doesn't necessarily change the neurology. It can help the neurology, but doesn't necessarily change it. If you get too far out of that, then the neurology starts changing. You bring it back, the neurology is now better. Okay? But that only comes through. We used to think, and we used to tell people adjustments will do that. We now know that's really not the case. Like you have to do more than that. So you have to do more of like a physical therapy type approach. The problem with physical therapists, like, because they argue with me, like I get in arguments with them, I'm like, man, we just do different things. I'm trying to get physical therapy of the spine to get back to that 20 to 40 degree range.
Yep.
You're trying to get full range of motion of my elbow. You do a fantastic job. I don't really know how that works. I can if I study it. I learned it in school. I don't care about that. What I want to do is get your neck back to 20 degrees or more or greater, right? And then you can measure it. I can bring a person like you, look, man, this is the science. Like, you can argue with me if you want. If you have a better study that shows otherwise, I'm all ears. I'll listen. I don't care.
I think the best study is the happy client.
Yeah.
The person's like, oh, I'm sleeping better. I have more energy. So let's talk about that for the people that take advantage of your services. How many are coming back? How many are leaving your office really happy? Like, I can't wait for my next
100%,
adjustment.
man. Every single no, I'm just kidding.
Hey, us too at 719 Lending.
Yeah, everyone's happy. Yeah. I'll tell you this. When people come in, what I ask them is, what do you want? Like, what is your health desire? What is stopping you? Because you were a boxer. My dad was a boxer. My dad was a boxer up in Canada. He's very, very good. He's given me several bloody noses, two. Several, right?
If his name was Jack, you could have called him Yukon Jack.
No, that'd be awesome. I might change my dad's name to Jack. His name's Fred.
Yukon Fred? That's got a pretty good ring to it.
Yeah, it's not bad.
Maybe Northern Territory or Labrador Fred?
Labrador Fred. Lumberjack Fred. He was a lumberjack at one point.
That's got a ring to it.
Yeah. Dang it, I forgot what I was saying. I just have a picture of my dad in like some overalls and yeah.
Beat a boxer. Boxer similarities, impact on chiropractic.
Yeah, okay. So he's a boxer. There's abuse that happens to the body.
Oh, yeah.
And what happens, a lot of people just get comfortable with it, and then they don't think that they need any kind of help or correction with it.
Mainly men?
Mainly men, yeah. So when you come in, what I do is I ask you, what do you want? How can I help you? What are you not able to do that you want to do? And most people are like, I can do anything I want. Really? Okay.
Why are you here?
Yeah. And with that, I just start asking too, okay, are you able, what were you doing in your life? And then are you able to do that the same? Well, no. Okay, so you can't do that as well. Do you want to do that again? Once I figure out what you want, then I try to see what in your body is stopping you from doing that, and then we create a plan around that. Most of the time it includes chiropractic, but sometimes it doesn't. Sometimes I got to send you somewhere else and get other help somewhere else that I can't do, right? And then when you come in for the re-exam, there's a long answer to this point. When you come in for the re-exam, we put those main top 4 things on the top of the paper of what you came in for, how they are doing, are they improving? And then below that, there's a list of like 50 different health things, and I want to know if any of those have improved. Because on day 1, if I go through that, that's where it may seem like a pseudoscience, like you're going to help me with my gastric issues. Like,
go on.
Yeah. But then when you come back in and then you start checking these boxes, and you're like, actually, like this, I'm not trying to be funny, but like you come in and you're like, actually, I haven't had constipation in a month. And it's like, I didn't know you could help with that. Well, if I do, I'm going to sound like I'm a pseudoscientist, but if your body's resources...
results don't lie.
Right. And then they're like, that's where I make people happy. And then they start realizing, hey, this can help with other things in my body other than just this numbness that I have in my fingers. So when I talk to people, I talk about concrete things that they can relate to very easily. I don't talk about those other things that seem, quote unquote, quackish.
Sure.
Do I help with them? Can I help with them? Do I know exactly how I help with those things all the time? I'll be the first to admit, no, I don't, man. But what I do know is that when I get the spine in line, the spinal cord talks to the body and controls it.
Is that an advertising tagline when I get the spine in line.
Yeah,
All
you
right.
feel fine all the time.
Oh,
Yeah.
you're a poet and you didn't even know it.
That's right, baby.
Anybody want a peanut? Stop rhyming, and I mean it. Okay, so one more
I'm a
fastball.
rapper.
Right. One more fastball right by your chin. And by the way, where you gonna hang in the box with me? Like,
Yeah.
you're converting me from skeptic to curious.
Yeah.
How many people come in for an appointment and you're like, holy beep, your spine is straight. You don't need any work. Does that ever happen?
Well, not really, man, because people are coming to me because they have a problem,
Oh, okay. Yeah.
So not very often. That's why I actually rely on the studies. It's called, is it recency bias? Is that what it's called? Because you're in it all the time. It's the same idea as like police officers. Like, when a police officer pulls me over, I'm really kind of like, I give them a lot of grace because 90% of the time, who are they dealing with?
Well, you got to tell them a joke. If you get the cop to laugh, you're going to get a warning.
Yeah. What's the difference between beer nuts and deer nuts? Beer nuts are $1.25 and deer nuts are under $1.
Oh, nice.
It works every
Yep.
time.
Wow.
Yeah. I use that for free
Hold on.
French fries.
One of these
at
buttons
Wendy's.
is really good. There it is.
Yeah.
Yeah.
But they deal with like the bottom 2% of society
Yeah.
all the time. So and that's kind of what I deal with, right? Not the bottom.
Hold on. The people who go to your services are the bottom two.
All the heroin addicts. No, we are
there
on
government
Bijou Street.
subsidy for
we
that?
are on Bijou Street. So, what I mean is, I'm dealing with people who are in pain a lot.
Sure.
They're going to have an issue. When I do look at patients, because like people will come in, I do get this. They'll come in, they're like, "Can I just get checked out? I just want to see how my spine's doing." Now, that doesn't happen very often. I wish it would happen more often. But when it does happen, I'm not surprised that they are actually a lot closer to normal than like a guy who's been boxed and, his head is snapped back and now he's got pain in his upper thoracic spine. Like, that doesn't surprise me that this person, they're pretty close to normal. So, no, that actually happens whenever they come in for that. That's actually pretty common. That I'm
Okay.
like, you're doing pretty good.
So they're not in serious pain, or there's not very evident things that they need to have resolved. Okay.
Yeah, by the time symptoms come, like only 1 in every 9 nerves approximately is a pain sensory nerve. So by the time you're in pain, there's other issues that are going on. You know what I mean? I start with the pain, but then we backtrack to those other issues.
Now, last question, then I got to pretend to go work again.
719 Lending.
Right.
The greatest work pretenders.
It's
No, I'm just kidding.
that's how good we are. We don't have to work. So I'm thinking to myself, my dad dealt with a herniated disc, and you're going to know much more about this than me. But as I understand it, as a layperson, you've got the degeneration of the cartilage between two different vertebrae. That cartilage wears down, so the vertebrae is now rubbing against each other. You got a pinched nerve in there. It was an issue that he had really seriously from playing racquetball. Like me, he started gaining weight in his 30s. So, if you're visualizing right now, I call it festively plump. It's not like
I just call it huskily strong.
there we go. That's even better than festively plump.
That's
But-
what I call myself. I'm in my 30s too.
Well, yeah. So my dad was. I'm in my 40s, but my dad was in denial, and so he kept on behaving like a maniac, playing racquetball and tennis and everything. When he's like, 250, 2 spins and 2 clicks and 1.5 more on the scale, and that obviously took a wear on his back.
Yeah.
So I'm thinking to myself, if these adjustments are occurring on a fairly regular basis, is this a preventative measure in creating appropriate space or strengthening of muscles or tendons so that these degenerative disc issues and these herniated disc issues aren't occurring?
Proper movement is going to be the precursor to that. That's why just traditional chiropractic care, like a whack 'em crack 'em shop, is going to be good.
Okay.
Because you're going to have better movement inside of that joint, that joint complex. But that being said, like there's certain things that are bad for you. Like I am not a proponent of sit-ups at all.
Okay.
They round the low back. It puts bad pressure on the disc. And that disc is, it's more than just cartilage. It's actually like fibers that are crisscrossed in circular patterns. And in the middle, there's like a fluid, like a gel-like substance. And so when that tears and that fluid goes out, now you're going to have a chronic issue. Discs actually don't have a lot of pain nerves in them.
Interesting.
The joints of where the vertebrae move have a lot of pain in them. every joint has a lot of pain sensors in them, but the disc itself doesn't have a lot of pain sensors in them. When you get pain from like a disc, it's because it's herniated, it's gone outside of its bounds, and now it's pushing and touching on things that have no business being pushed on or touched on. And then the more you move that,
Sounds like it's moving into perversion status.
yeah,
It's touching and pointing at things it shouldn't be touching.
that's exactly what it is.
It's an Epstein disc.
That's what did you say? That's
We gotta put that disc in jail. Although it didn't kill itself.
no, it didn't.
Okay, I don't know what I just walked into, guys.
Welcome back, Mr. Chase. You are rescuing our host.
So
Did I walk into an Epstein joint?
It's a herniated disc metaphor. It
yeah,
makes perfect sense.
It does work perfect. Actually, yeah.
Herniated disc, got it.
You know, getting that disc back into place is very difficult. You can do decompression therapy, but ultimately, again, if you put those curves back where they're supposed to be, now they are where it's in a more comfortable state. If I take the entire shape of the spine and I round it the opposite way, it puts abnormal pressure on it, and then it's going to wear out faster.
That makes sense.
What you have to do is put that back. Being active is actually pretty good, but it's the activity that's bad. If you're doing sit-ups, that's not good. If you have a herniated disc and then you keep doing sit-ups, like, I'm just going to muscle through this.
It's good for your core.
Yeah, you like Dave Groggins it. Like, I love Dave Groggins. That dude's mind. There's some things that I'm like, nah, man. I mean, like, when the disc is pushing on the nerve, I don't care who you are. You can't just like mentally like, I'm over it. Yes, it all goes back to the brain, but you.
Him and Deepak Chopra.
What?
Him and Deepak Chopra.
Yeah. I don't get that, dude.
So
like,
that's a name I haven't heard for a while.
He's still jamming, dude.
I used to listen to Deepak a long time
Him
ago.
and Ricky Lake.
Ricky Lake. That's awesome. Is she still around?
Her and Maury Povich. I think they hang out, man. They're in a club.
I thought they died with Joan Rivers, but I could be wrong. I don't know.
So I said last question, but I do have another one.
Yeah.
How often are doctors working in conjunction with you through either PT or recognizing things or symptoms or diagnoses that you can come alongside and help?
Not as often as I would like.
Sure.
Why is that?
Again, this goes back to like the AMA. Like the AMA back in the day literally put in their curriculum that you were not allowed to work with doctors. They'd revoke your medical license. They would not allow insurance to pay out on, they're a governing board, so they wouldn't allow insurance to pay out if you're working with a chiropractor. There's a lot of anti-chiropractic. They admitted it in court. We won.
That sounds like the American medical mafia.
If you want to start getting into some conspiracies, man.
Wise guy, huh?
Yeah.
We're going to let the pharmaceutical industry in here, but those quacky chiropractors, let's get them out of here.
Well,
What could go wrong?
There's a lot more money in medication, man, than if I help you and I fix you. I mean, that's like one of the biggest problems I have, right?
Yeah.
Because if I fix you, I just don't see you very often anymore. And that is what my goal is. That's my goal is, what's the issue? How do I get you so that you can do this on your own? How do I get you to a point where you can continue your health on your own? So what's your goal? I can get you to this point. And then if you maintain that, you'll be able to hold it.
So I've got, for you listeners, I've got a proclamation. I've been converted from skeptic to curious. I'm going to do a session with you, and we'll talk about it the next show that I'm on.
Okay.
Whether or not I'm better, whether or not you made me worse. And I'll let you know.
What I would like you to do, too, is just talk about your new understanding of what's going on with your body.
Okay.
Okay?
Discover my body.
Make sure you do. Make sure.
Touching you.
Touching me.
Touching you.
On that
yeah,
note.
you're touching me.
There we go. Your falsetto's
Okay,
better than
hold
mine.
on before you go, Corey. I don't know if you asked this, but Missy had a question in there.
Oh,
I think she got too embarrassed to ask, so I got to ask it. When you are seeing, how many patients do you see in a day? Like 50?
Right around between 40 to 60 on the
Okay,
day.
A day?
Yeah.
that is a lot of patients,
It's
right?
exhausting.
So
In a good way, though. Like,
With-
it's enjoyable, but it's like...
Rewarding.
It's very
with that many patients, how big of a problem is flatulence?
Oh, dude. I get farted on at least 8 times a day.
A day?
Dude, a day.
Dude,
They never told you that in school, but it's like you push.
I mean, you're making adjustments.
It's like a windbag, dude. You push on the back, it's like... and they're like... I feel bad for people because they get embarrassed about it. By this point,
You're like, dude, you're the 7th one today,
Yeah.
man. Isn't it?
like,
Do you
I
miss
get 8 a day and you're number 7. Don't worry about it.
You've got to miss the COVID masks.
actually, it's funny you say that because like I didn't like the COVID masks. I mean like that. This isn't the show for that today, but I wasn't.
We're with you.
Corey might be the wrong guy to start talking to. He-
Or the right one.
It could be
Yeah.
the right
Right.
one.
Yeah.
Yeah.
I was banned from work for a while.
Yeah, I was banned from church, man.
Dude, me too.
Yeah, they asked me to stop coming to church.
Oh, dude,
Me and
you
my
rock.
family, yeah.
You're a patriot, by the way.
Yeah, thank you. I
You're
agree with that 100%,
Yeah,
man.
dude.
Like, so, but I
I'm
will
not
say,
gonna fart. I'm
God-
not gonna fart on you.
God loves you, but we need you to leave.
Yeah,
That's exactly-
Speaking of
you
which,
need to
Tim,
worship Jesus at home.
Tim had this really good idea of butt masks for you. So you just put one over there. You're protected. At least
Underwear
there's a
with
shield.
Febreze on it.
Sign Fauci and Pfizer up. They're gonna get butt masks.
so, it's
So
funny.
it's a normal thing.
Yeah. So during COVID, like the governor shut down chiropractors in Colorado. So when we went on, I was I adhered to the rules. To the letter because I got to provide for my family. I didn't
Yeah.
agree with it, but
Yep.
I can't
Can't put
no
your-
one's
your-
paying
your-
me money.
You can't be in jeopardy with your career.
Yeah, and I gotta put food on the table, right? I have 7 kids,
Yeah.
so it's like, all right.
Wait, you
kids,
have
so-
7 kids?
I have 7.
That's it.
Rock
I don't
on.
mess around, or I do. Depends how you look. at it.
Right? Actually, you do.
Yeah.
Quite frequently.
Very prolific. I'm Catholic or Mormon. You figure it out. So,
Mormon?
Come on.
Mormon?
Mortholic.
Mormon. Catholic.
Catholicism. Yeah.
So anyway, so I wore these masks, dude, and I was like, patients would they rip one on you, and I was like, this is the first time it doesn't smell bad. This is kind of amazing.
Have you ever had like an eye
So
watering
then I
one?
tried
it's-
it myself,
Uh-oh.
and they didn't know.
Wait, go back.
Oh, like a silent guy? Like, okay,
Yeah,
if this is how we roll.
If I can't smell them, can they smell me?
Oh my gosh, that's retaliation.
Yeah, that's fight fire with fire, right? I mean, the best way to put out a fire is a fire line.
So now that we're on the topic, have you gotten one that's like so bad you could not empirically tolerate it? Like eye watering, like, hey, I'm gonna take a 5-minute break. Go try to finish my lunch.
I mean, I don't know if I should answer that because I don't want to make patients embarrassed.
Yeah,
man.
it's got named Barry Arnold.
Yeah, I always try to make them comfortable. Like, it's okay, we're all right. I mean, when it's
This
really
is natural. Just
Not too
just
comfortable,
squeeze.
though.
bad, when it's really bad, I don't answer. Okay, I'm just like it's.
I'm gonna go work on the neck. Can you roll over?
Exactly. That's my go-to. It's like, go ahead and turn over now.
That's very professional of you.
Yeah.
I've only had one flatulating client in all of my mortgage history, and she was an old lady. She
Dude.
talked like a banshee, like how she had this screechy voice, and she would just like it was normal. Like I think she had issues, but it's just totally
Yeah,
normal.
old people are really are the worst the worst offenders.
They're flammable, of course. They're releasing
They're
gas
flammable.
all the
I'll
time.
tell you this, dude. I have a chiropractor buddy. Mind my language on this. I pre-apologize.
That's good.
But
You're Catholic, obviously.
yeah. So I will say this, dude. I have a chiropractic buddy. When people fart on him, because like I said, it happens very frequently. His go-to line. This is what he says. He goes, "If my adjustment made you do that, you're really gonna when you see the bill."
That is fantastic. Just steal that.
Yeah,
Just steal that.
it's awesome. I'm like,
What I think is amazing is when our host said earlier, go ahead and turn over. This is obviously something he said frequently.
yeah.
He looked like a ventriloquist, which is trying not to open your mouth to let the fart gas come in. Go ahead and roll out. You're trying to you don't want to let it
Go
in.
ahead,
You
roll
can
over.
just exhale then. Go and roll over.
I don't want to taste it. If I open my mouth wider than this, I'm tasting it.
Is that ketchup? An onion?
Barbecue, huh?
Your show has taken a turn for the better, I think. Thanks for having 719 Lending on your show today.
Oh, that's phenomenal.
All right, I'm coming in. I won't fart on you, I promise.
All right.
You'll hear from me
All right,
next
man.
time.
All right.
Thanks for having us.
Absolutely. Have a great day, guys. All right, so I'll wrap up today. A couple other points that were brought up. And one is the chiropractic journey. When you go in to see a chiropractor, there's a couple things that I think is important, and I'd like to just, number one is know what you kind of want to accomplish or what you're trying to get out of care. If you're going for a holistic conservative approach, you want to avoid medication. You want to avoid surgery, that kind of health journey, which is not very healthy. I mean, like there's tons of evidence that just show the more you do that, the worse your health gets as you age. If you want to avoid that, go into your chiropractor knowing what you want and how they can craft and create a plan for you so that you can get that out of your life. That's like number one. Number two, going back to like every chiropractor is kind of on their own journey and to a certain extent as well. I'll say that like I have an awesome benefit in my life. Number one, and that benefit comes from my dad. You know, my dad graduated back in 1988, and then he had to figure out a lot of this stuff out on his own. And working for him growing up and seeing the different, you know, like my dad is a true clinician. Hats off to him. Like I just have such a wonderful example in my life of how to be a good doctor and how to really care for people, how to listen to people, and have compassion for people. My dad was that guy. He is that guy. He is that practitioner. And he has a lot of compassion for people and trying to help them get that way. And because of that kind of attitude and that type of feeling and that service mentality, what he was able to do is continue to get better on his own, to continue to learn. And he's a humble enough guy where if there's new information, he will incorporate it. He does not become dogmatic about just his experiences. He's got incredible clinical experience, but he's always willing to take new information and to incorporate it into his practice and into his patients. And I am the beneficiary of that because I was able to be on that journey whether I liked it or not when I was younger. And now at this point, I get to continue to take what he's learned and take that a step further. When it comes to like expertises with chiropractic, I feel like I'm really good at fixing the spine and what that causes and how that helps individuals. My brother called me. He works with my dad. He called me about a patient who got a knee surgery and it did not heal well. And so his leg is bent out about 30 degrees, very far. He took spinal x-rays of him and this kid's spine is messed up because it's been about, I think, 6 or 7 years of him walking and being in this position, this altered biomechanical spine and legs and pelvis. And because it's been altered for so long, he's starting to get other changes. This is the kind of perspective that we have because this kid now wants help. He's having other back and spinal related issues, but the root cause of this kid's problem is really that knee. It's got to get fixed. He's got to get balanced. We can sit there and work on him and we can improve him. There's no doubt about that. But am I going to get him back to where he was? No, until the knee gets fixed. That's like where the problem started. Now, prior to that, there's a lot of other information, you know, like maybe he was concussed and that's why he got an ACL rupture. You're like 8 times more likely in the first year to tear your ACL or have an ACL rupture after post-concussion. And so maybe that's why he had it. We don't know that information. But what we know now is he's coming to a chiropractor because other people aren't willing to help him or to listen to him or get to the root cause. And because of my dad and his guidance in his life and his influence on me and my 2 brothers as chiropractors, our perspective and our expertise is really at fixing the spine, at looking at it and trying to figure out what's actually going on with the patient. That's an outlook. That's something that you have to interview for. And I would say you need to interview that way for any doctor that you're going to see. If your doctor's got an issue with you, with getting a second opinion, then that's like a very good indication you probably should see a different doctor. Everyone has a different opinion. Everyone has different knowledge, and everyone's application of that knowledge is a little different. No 2 surgeons are going to cut the same line the exact same length in the exact same way. No 2 chiropractors are going to hold the neck the exact same way when they adjust. If you have any questions, please like and subscribe. This is the Wellness Quacks. My name is Dr. Dylan Clark. I work at Peak Family Chiropractic here in Colorado Springs. Feel free to just stop in and see us. Again, I want to thank 719 Lending. Leave any comments or questions below. So you guys have a great day. Go out there and quack it up, baby.